Hi, my name is Mark Riley, and I'm a BS in nursing student at Florida State College of Jacksonville in the Community Health Nursing program with Dr. Lawrence Rosenquist. And this presentation is about long-term care nursing in the community. Essentially, I want to just go over what is long-term care, what is a long-term care nurse, and a long-term care nurse is a nursing professional who's dedicated to caring for patients and residents in need of extended care. Often they're providing care for that same person over months and possibly years. Nurses in long-term care are often in a supervisory role. Not only are they providing bedside care, but they're also supervising LPNs, CNAs, and work with a lot of other healthcare professionals. What type of patients does a long-term care nurse see and or treat? And essentially, somebody who is unable to perform their activities of daily living, somebody who needs that long-term care, and that could be somebody who just also needs extended rehabilitation. It could be somebody who is in need of home health care that just simply doesn't need a long-term care setting, but just needs that care provided in their home. Largely, the long-term care nurse is going to see the elderly population, and essentially 25% of adults 65 years of age or older will spend some time in a long-term care setting. Long-term care nurses can work in various settings, from an assisted living facility, an independent living facility, in a clinic, in a skilled nursing facility, which I think most people think of, a rehabilitation center. We have many of those here in Jacksonville, Florida, in retirement communities, and also in home health care agencies. Long-term care nurses, how do they serve the community? So as I'll show you in another slide, we have well over 15,000 nursing homes in the United States. Well over 1.7 million residents in a nursing home. And nursing home and long-term care settings, they are communities in and of themselves. For my own grandmother who lived in long-term care for 5 years, it was the best. It was the number one best choice that she made, and because she met other people that were like her, that understood each other, that shared same cultural norms and values, and they formed a community. And it's important to know that every person who lives in a long-term care setting, be it in a nursing home, an assisted living, an independent living, every single, or even places like Cypress Village where they have homes, anybody who lives in a long-term care setting is a resident. But not every resident will become your patient. But long-term care nurses serve that community, and in many cases in wellness through education, disease prevention within that community. The elderly are a very special population with their own unique needs, such as a strategy for injury prevention, wellness, end-of-life care. These are very special to the elderly population. And that's where the long-term care nurse is truly specialized within this community. Long-term care nurses are very much advocates, and oftentimes they become embedded with the residents and become family. The primary activities of a long-term care nurse are, of course, providing that direct care, assuring the quality clinical care, supervising others, assessing the health conditions, and developing treatment plans with the residents and the families. The scope of practice is very much, this is from the Florida Nurse Practice Act. Essentially, nurses in long-term care are like nurses in many other specialties or community areas where they're observing, assessing, and providing nursing diagnosis, planning, intervention, evaluation, providing teaching. And also it's important, specifically in this long-term care population, to look at wellness and injury prevention, and how to maintain one's health, as oftentimes health deteriorates with age, or does deteriorate, not oftentimes, I think it's a fact. So typically the nurse in long-term care will be providing medications and supervising others. Some unique teaching learning strategies for the long-term care community or that special population. It's very important that we promote health literacy within this population. But as part of that teaching is that the long-term care resident should be screened for anything that may impair their learning. And those are typically those senses that degrade with age, such as vision, hearing, sense of touch. And if appropriate accommodation can be made before a nurse tries to teach that person, that will really help in that engagement and their cognitive ability. It's also important to break down simple steps, complex tasks into simple steps, such as a glucometer, rather than trying to go through a complex step in operation of teaching a long-term care resident how to use their machine. It may be as simple as telling them to, step 1, set up the glucometer. Step 2, choose your appropriate site and clean it. Step 3, sample your blood. And then step 4, record the value. Breaking things into simple steps seems to work very well for this population. And also allow ample time for processing when teaching this long-term care community. Educational preparation is needed for long-term care nurses. The American Association College of Nursing has recommended specific competencies with regard to gerontology or geriatric nursing, and they've recommended these be placed into the schools, particularly in the BSN program. And those basically 4 core competencies are cultural issues, communication skills for the long-term care population, grief and bereavement, as oftentimes the long-term care nurse will witness and experience the death of one of his or her residents that they've cared for quite a while. And also pain management for that elderly population. Other disciplines, professionals that the long-term care nurse will interact with are, of course, licensed practical nurses, CNAs, unlicensed personnel, dietary staff, social workers, nurse practitioners, EMS personnel, and paratransit nurses as well. Necessary skills, plenty of necessary skills needed. And essentially, the long-term care nurse must, in addition to being competent in the scope of practices, or in the scope of practice, it's essential that they are able to establish and implement a nursing regimen to care and comfort the individuals and work on injury, illness, disease prevention, provide education to the resident and their family, and also be able to supervise. Some unique challenges for long-term care nurses. Long-term care nursing is extremely heavily regulated. The Agency for Healthcare Administration and other agencies are routinely visiting and surveying and certifying long-term care facilities. So that's a challenge that other nurses may not routinely encounter. There's a big reliance on unlicensed staff and the need to delegate in long-term care nursing and to kind of form an interdisciplinary care plan with other healthcare providers. Long-term care nursing can be very labor intensive, particularly for a resident who's unable to move and needs turning or assistance with their daily activities. And there's a tremendous one-on-one nature with the nurse and the resident, which to me is a draw and a benefit and allows there to be rapport building and relationship building. Again, kind of the embedded, the nurse also being a part of that resident's family. And some interesting facts that we learned is there's over almost 16,000 skilled nursing homes in the United States, over 1.7 licensed beds, and 5% of our population, 65 and older, is now residing in a nursing home. So here are just some references. Thank you for watching this short presentation. Take care.